Good afternoon. Today's pep talk will be about traumatic brain injury and sensory stimulation. This was a course that I actually got to participate in at the Toronto Brain Injury Conference last month. I found this course to be very interesting and very intriguing, and I hope that you guys can take away something. This course was taught by Dr. Deborah Tang. She works for the NRIO. She's a clinical director with a PhD in psychology, and she specializes in neuropsychology and rehabilitation. Melanie Hay is a registered OT who focuses on assessment therapy and support for clients and families. Some of the learning outcomes we had for this course was to identify the characteristics of minimally conscious states, analyzing the outcome of sensory stimulating programs on patient recovery, and developing a multidisciplinary toolkit for supporting minimally conscious clients. And just for a refresher, the definition of a coma is a prolonged state of unconsciousness due to severe injury or illness. The consciousness components are both wakefulness and awareness. Wakefulness meaning controlled by the brainstem, which regulates eye opening and vital functions. Awareness meaning involves self perception and environment controlled by higher brain structures. Locked in syndrome is the paralysis with, in fact, awareness and communication through eye movement or blinking. Common causes of a coma are severe head trauma, brain injury, stroke, or cardiac events, infection or toxins, and blood sugar extremes. Brain metabolism across levels of consciousness. Here is an MRI brain scan of the different types of consciousness. The brain metabolism decreases with the level of consciousness, and the medial posterior cortex precuneus and posterior cingulate cortex is key to consciousness. Note that the locked-in syndrome shows no significant decrease in metabolism. What does current treatment look like? Low intensity brain injury rehabilitation offered for individuals with severe ABI, focus on clients with complex needs, and slower recovery rates. Eligibility is determined using the Rancho Los Amigos scale. So the Rancho Los Amigos scale is a scale that they use to determine how unconscious a patient is. Usually levels 1 to 2 mean that there's minimal response to stimuli. And then level 3 and 3 plus is when a patient is qualifying for active hospital rehabilitation. A few positive outcomes of the effectiveness of sensory stimulation programs are sensory stimulation has shown immediate and long term improvements in sensory functioning. A systematic review demonstrated increased GCS scores after multimodal stimulation compared to no intervention. And there was a 20 out of 21 studies reported the benefits for low and higher level sensory deficits post stroke. Here's a sensory stimulation kit. What I thought was really cool, it was basically like a toolbox that they would use for patients that are unconscious. These toolboxes would be filled with sensory items. Here's a picture that kind of shows what someone would put in a sensory box. You can see that there's a clear plastic box. They could have pictures of musicians that they like listening to, places that they've traveled to. There's colors, different smells, sensory items for texture, something they could feel when they're in the hospital. And then also there's a mirror where the mirror is very important because a lot of uh, patients won't end up looking at themselves. So the mirror is a way that they can see their reflection. And then Melanie did mention that this is something that patients can use and it can be an inexpensive um, thing that they can use. So they can go to the dollar store and buy some supplies, or they can go around their house and put pictures of family members in the box or whatever that they prefer. Sensory stimulation guidelines and modalities. It's very important to check in with caregivers as you're doing the stimulation therapy with the patient. It's also very important to prepare the person for stimulation every session. They suggest to start with calming stimuli and then progress to excitatory, and to use 1 or 2 senses at a time. And then afterwards, to allow 1 to 2 minutes for a response and explain stimuli to the patient. And then some suggestions too was to control the environment, minimize distractions, and ensure the patient is comfortable and allow time for the patient to respond between each stimuli. Some other key sensory modalities are visual photos, bright objects, auditory music, familiar voices. They even suggested having like a recording of a family member speak. Tactile objects such as textured objects, temperature changes, proprioceptive motor, weight bearing, assisted movements, and familiar sense. In regarding to the visual and auditory stimulation, like again, they suggested family photos, mirrors, bright objects, videos to enhance tracking, recognition of objects, and emotional responses. And then their suggestion was to begin with large, brightly colored objects and gradually introduce more familiar or detailed visuals to increase eye opening, fixation, tracking, and recognition. Auditory would be the familiar voices, favorite music, and environmental sounds such as birds or animals or the wind to improve response to auditory cues, orient to sounds, and encourage emotional engagement. Reflective blinking, pupil constriction, dilation, orientation to sound and emotional responses. The proprioceptive motor would be to increase the patient's range of motion. Would be suggested by using weight bearing exercises, functional movements with familiar items, responsiveness, reflective, posturing, yawning, sneezing, uh, intentional localized movement, facial expression changes, and functional item use. Um, Smart goals would be to start with the hands, thumbs up 3/4 of the way within 20 seconds over 4 weeks. Tactile stimulation would be texture, temperatures, and familiar objects. And then here is just a visual of the proprioceptive motor and tactile simulation. So it looks like there's some gait aids and some other accessory items that they could be using. Oral motor conditions would be test swabs, toothbrush, tongue depressors, whistles, responsiveness, tongue prompting, um, intentional movements, hygiene, jaw tightness, taste loss, and cultural preferences. This is just to get their mouth moving again. So what they have learned since doing this stimulation program is they've learned that each client has a preferred side or limb, that the clients often show better consistency with one side or limb. The wakefulness improves over time, provided there are no health issues. Optimal session length is about 30 to 60 minutes. The longer sessions need breaks. They did mention that the sessions typically start within 30 minutes and then they'll gradually increase them over time. Responsiveness to people. Clients respond differently to different people, even when they are given the same cues. And then here's just a visualization of using nonverbal cues with their hands. And determining the consciousness of a client is very important. Up to 40% of patients are misdiagnosed as vegetative when they are actually minimally conscious. There was a story that they actually talked about. There was a man in Kentucky um, that got pronounced brain dead, and when they started to try to remove his organs, he actually woke up. So it's definitely important that everything is concrete and that all the notes are detailed and the patient is assessed successfully. Patient progress and family integration. Patient progress is improved responsiveness, including eye tracking and localized responses, enhanced cognitive and physical engagement, and long term positive outcomes for consistent stimulation. Family roles provide a key role in a meaningful stimuli, actively support program goals during sessions, and strengthen the emotional and motivational connection with the patient. In summary, the key program insights are to update sensory programs regularly to maintain engagement. Training is key to consistency and success. Family and friends play a crucial role in therapy. Orientation board helps staff connect with clients' needs. Thank you for listening, and I hope you guys learned something from this as much as I did. And take care and have a great day.